Hello and thank you for contacting Wave. From your request, it appears that your lenses are fitting too tight on your patient. That's why you're getting the seal off. If we look at your topography, just a couple general comments. As you probably already know, since these keratoconus patients, it's hard to get good total corneal data, so we tend to get the central steep area and we don't really get anything out here in the periphery. So Wave is, when it reads this topography, it's going to interpret this whole area between, say, 5 o'clock and 10 o'clock as a steep cornea. It doesn't really know that that area is flatter out there. So just keeping that in mind if you're using a lens that's sort of taking the average of the whole cornea as you do in an RSIM design, you're going to lens that tends to fit on the steep side. If we look at some of the data up here in the pointer values up in the right hand corner, you'll see that the radius of the pointer, which is its central dot, is at about 6.3, and if you look at your current design in the RSIM, your base curve is at about 622. So that does tell you that even in the central part where we do have some decent corneal data, we have a lens that fits a little on the steep side. So, and of course it's kind of visible right here in your design. You can see it's a little steeper in the center and it comes down here. And of course you can't really tell much in this peripheral area just because you don't have a whole lot of true data out there. So a couple thoughts. One thing I would probably consider doing, I know in one of your earlier designs you tried a freeform design, but I would probably leave it in tangential. Tangential tends to give you a slightly flatter fit in general. I would consider going to freeform and also adding in a little of the S factor. And what will happen if we show up a lens like that, what I did is I basically clicked over to freeform and hit tools and redesign the lens. And now if you look in each quadrant or in each radial, you'll notice that if you look at that base curve down on the lower left hand side, if you click all the way around and spin the dial around, you'll notice that you become much flatter in all the meridians going around the clock dial. Once you have that design, since you almost have to manually adjust the peripheral cornea, I would just click up on that pink dot and just raise up the edge, probably 5 to 10 clicks to raise that up to try to get a little more lift, maybe even pinning it up somewhere around that 20 micron line. So by doing that, you get a lens that in theory should give you a little bit flatter fit overall and also give you more of an edge lift. So those are some of the adjustments that I would consider making for this particular case. So good luck with that. These cases are very challenging because you don't really have true data that you're working with in the periphery. So quite often you just have to use your best judgment. One more comment: if you do want to stay in the RSIM design, basically what you can do is to flatten this lens out a little bit. Just click up on the red dot, maybe 5 to 10 clicks, and you'll notice that the central base curve starts flattening out a little bit more. Once you get that to the desired base curve that you want to go with, then you can also lift up on this periphery a little bit more to see how much you can get away with. So you can do some manual adjustments on this RSIM design if you'd like, but again, since you do have some irregular corneas centrally, you may want to try to capture as much of that as you can by using the freeform design. That may help hide that, get rid of that air bubble that you're capturing down to the lower part of the cornea. Well, anyways, I wish you well with this case. Thank you for contacting Wave, and have a great day.